required delete. So again, I am just look at focus. The nurse is assigning the client for 4 client, the planning the client and client round, which client. So there are 4 patients, which one we has to check first. So number 1, post-operative patient are ready to discharge, so they are stable, nothing hurry. Number 2, daily dressing. So it is not the life saving. Okay, if you go 10 minutes later, they will not die. Number 3, a client scheduled for the chest X-ray after insertion of the nasogastric tube. This is little bit hurry. At least number 3 is hurry than number 1 or number 2, because the insertion of the nasogastric tube through the mouth, go to the stomach. So if the patient position is not in the correct, this is a problem. So number 3 is important. But what about number 4? Number 4 said patient has a asthma. So if you check the oximetry, put the hand, you can see the saturation of oxygen may be below 90. So this is the oxygen deprivation or oxygen need. Oxygen put the patient and give them some um, um, comfortable feel, right? So this is the reason. Number 4, and also I told you just follow A, B, C, D. A for check the airway. B for breathing. So number 4, follow A and B both. Check the airway. Airway is clear, but breathing problem might be patient has asthma, shortness of breath. They need the care. So the number 1, number 2, even number 3 is not A, B, C, D, 4, any nothing. Respiration, number 1, no talk about the shortness of breath. Number 2, not talking about difficulty of breathing or active bleeding, which is circulation problem. Same as number 3. It is important, but not airway related, not the respiration related. But number 4 is related, this one. So if we do something wrong, we has to read and learn. Because of this, we are learning. We are here. So airway is always the highest priority. I said A, B, C, D, and nurse would attend to the client with asthma who required the breathing technique during previous shift. So if the patient has a history of asthma, shortness of breath is most common. If you give little bit oxygen marks on their mouth and patient feel good, right? Just little bit your assistance and patient feel good and comfortable. Oxygen supply. And always I said oxymetry, small device is there. Put it to the finger and check the saturation of oxygen. If the patient has saturation rate of 90, less than 93%, it is the first priority. So saturation of oxygen should be 94 to 100% normal, but less than 93%, it is the priority. Also keep the note, very important for our NCLEX board exam, super important. If patient are the healthy, no history of COPD, no history of respiratory disease, asthma, bronchitis, that time saturation of oxygen should be 94 to 100%. If less than 93%, this is the first priority. But if the patient has a COPD, history of COPD or bronchial asthma, right? That times the saturation of oxygen level normal less than 93%. So if in case of COPD or bronchial asthma, the saturation of oxygen if less than 90%, right? This is the first priority also. So as I told you, when you go through, we have to follow the ABCD law, or we have to check the Maslow's law. Maslow's law means the first priority, which is the first demand. Like food is the first priority. When you have a food, then you need shelter. When you have shelter, then you have need other belongs. So as I told you, when you read the question, always check which is the first priorities, right? So either the when you choose the answer, either the follow A, B, C, D law or Maslow's law. Anyone you must follows. Okay, go to the next question. The RN employed in a emergency department and is assigning to the triage, the client coming to the emergency department for the treatment on evening shift. Anyway, the nurse should assign the priority which one first. So this is the 4 patient, right? Which patient you has to go first, or who are the best RN has to check the patient first, right? So they said the nurse employed in an emergency department, ED, and also is assigned to the triage, the client coming to the emergency department for the treatment, whatever priority, okay? So should assign priority. Always keep in mind who are the most skillful RN has to go for the most critical patient to deal. Keep in mind something important, like we are working in ICU, and due to some reason, intensive care unit, the RN is shortage. So another department like neurology or surgical unit or gynae, they are come to help us. Also, we have to find out who are able to deal with the patient. Most unstable patient means serious one. Most skillful RN has to deal with. So how we have to know the patient is unstable or not? Very simple. Just check the vital sign. If vital sign is fluctuating or hugely increase or decrease, means they are unstable, very serious, right? So go here. A client is complain of muscle aching, muscle pain, right? Headache and history of seizure. History of seizure. Keep in mind, it is important, this one. Safety is priority. If any patient has a history or active attack of seizure, seizure means involuntary muscle movement, involuntary. So if the patient has a seizure, first priority, safety. And also we have keep the equipment bedside, like suctioning, oxygen, So it is the client complain muscle ache. Muscle ache means muscle pain, headache, and also headache, history of seizure. The client who and number two, a client who twisted her ankle when roller band blending and is the request the medication for the pain, right? Pain is the important, the pain also the priority, but what are the level of pain? Is it mild, moderate, or severe? Twisted the ankle and pain. The client with a minor laceration on the index finger sustained while cutting the eggplants. You see, minor laceration already mentioned there. Index finger minor laceration, not cutting. The client with the chest pain who state that he just ate pizza and that was made with a very spicy sauces. So chest pain, right? And who start the chest pain start also. Patient has a history at the pizza. So I said chest pain is important, but here in this question does not mentioning the patient age. If the patient is 65 years old, chest pain, and if the patient is young adult, chest pain is not same, right? So I said the age is most important for the cardiovascular disease if patient do not have any congenital health problem. So if patient has a chest pain or we have to exclude, is it because of the heart problem or because of gastrointestinal problem, right? So it is important. Chest pain, we have to evaluate it. The number three, minor laceration mentioning. Number two, twisted ankle. And number three, muscle ache, headache, and history of seizure. I said seizure is a very emergency. We have to safety first, right? And chest pain, we have to evaluate it. So what is your answer? Some of the student already.
Number one.
Yes.
Number four.
Okay, number one said, and
Number one.
yes, one student said number four as well, but she does not have enough confidence. So no problem. We are here to learn. Yes, I said we are here to learning. Let me explain. Like my confusion, number one and number four. Thanks God, there are four options. At least we are sure that number two or three is not an answer. Answer might be number one or might be number four. So as you said that little bit pain in the ankle joint, also pain level does not measure mentioning there. So you are not thinking about number two. Number four, minor laceration. So patient can wait. So now question number one and number four. We know that seizure is the one kind of emergency. So why not number one is the answer? This is my question. So the reason being why number one is not answered right now, answer, the client complain of muscle ache, means muscle pain, headache, and patient has a history of seizure, means it does not tell seizure is right now. So you have to prepare with the equipment, with the manpower, but patient is okay right now, only muscle pain. If seizure actively attack, you have to give the most priorities. You have to give the most priorities. So I said when you read the question, it is very important. Find out the keyword find out the theme or examiner mind, what they actually asking. So if number one should be answered if they mentioning the attack of seizure. They does not mention the attack of seizure. They said has a of uh, history of the seizure. The client with the chest pain who start the justice. So number 4 is priorities here because this will make a confusion. You have to find out. You have to find out, is it for chest problem? I mean heart disease or gastrointestinal problem. So this is the reason being number 1 is not an answer because history of seizure, not a active seizure. Patient do not have the attack of seizure right now, but patient has a chest problem right now. But I said, like the number 4, after EKG, you see the patient do not have any chest problem, means patient is safe. But if the patient has a heart problem and you neglect it, then patient will be expired, maybe. So this is the reason they like for. So what is their rationale? Let me read it. In an emergency department, the triads involve brief client assessment. You see, assessment to clarify the client according to their need of care. So we have to go for assessment number 4. What it is it for the chest pain or for others? Just ask them some question. The pain is radiate through the left hand or left shoulder, left jaw, indicate chest problem. If patient say, no, I do not have any problem this way, my pain go back to my backside, means GIT problem, pancreatic problem, right? Or
I
patient.
have a question, Professor.
Yes.
So with number 4, right? Why I'm slightly confused. If the client had chest pain, right?
Mm-hmm.
Due to him eating the spicy sausage, wasn't it a possibility that he had some acid reflux because of the spiciness?
Yes, you're right.
So,
You're right. Yes.
so
Yes.
that's why I'm confused as to why
Yes.
that's the answer,
So,
because he stated what he ate.
okay. This is your point, and everybody are thinking like you. This is the reason they has to go for assessment the patient. This is the reason you have to ask some question. Is it for gastroesophageal reflex or heart problem? But I said to read this, it is not enough to understand the patient has a gastric problem or heart problem. So you have to ask them little bit more question to elaborate, to exclude. But I said we are thinking about out of this 4 patient, we're not thinking the other problem, but out of 4, you has to find out the number 4 patient first, and number 2 and 3 is not an answer, but number 1 we has to observe because patient do not have any active seizure right now. So what you have to do, the point you find it out, my patient is a gastric problem, but also you have to keep, you are a healthcare provider, you have to think everything, and always you have to keep the danger first. When you think the danger first, you can save the life. Like your patient, you have a 2 question in the number 4. Patient has a gastric problem, maybe, not sure. Or patient has a chest problem, maybe, not sure. But when you ask 2 questions, then you have to just need 2 seconds to ask, can you tell me the pain is radiate to the left hand or left jaw? Or you have to check vital sign. If you see the vital sign is completely okay, pain is not radiate, then just keep it the patient, go for the other patient. Means patient has a problem of GIT, gastric reflex. or just do a rapid EKG. You need less than 10 minutes or 5 minutes check, or you can tell your assistants just check a EKG and see EKG is normal, then patient is stable, means patient has a gastric problem, and you go for the other checkup. But I said if the question number 1 is mentioning the active seizure, your answer should be 1. But number 1, do not say anything about the active seizure, see history of the seizure. So out of 4 question patient, number 4 is the priority out of these 4. So we should go for next patient. Yeah.
Mr. Abi, this question is very wrong. Number 4.
Okay. Then if you have